Mr. Jones,
Yes.
my name is Malcon,
How are you?
medical student working with the doctor today.
Okay.
So I understand that your daughter Laura,
Yes.
she's been having some vomiting.
Yes, she hasn't been feeling well. I'm really concerned, doctor.
So how long has that been going on for?
She's been vomiting for the last 3 days.
The last 3 days.
Yeah.
And has it gotten progressively worse?
Just about the same.
About the same.
Yeah.
Was she sick at all? Did she have a fever or anything like that?
Yeah, she had a fever for the past 3 days. It was like 101, 102.
Okay.
Yeah.
And has she been able to keep any food down at all or any liquids?
No, she won't eat any solid foods, and she can't keep anything down.
Okay. Have you guys tried anything for it?
Yesterday I tried to give her like 4 to 5 ounces of some ginger ale,
Mm-hmm.
and she threw it up and complained that her tummy was hurting. So.
And how is she at home right now? Is she laying in a bed? What does she look like?
Today she looks very lethargic,
Okay.
like worn down.
Okay, so she's really not moving around too much and just looks really sick.
Yeah.
Okay, and has she had anything like this before?
No, she hasn't.
Okay, all right. And was there anyone around her that was sick at all that you can think of at school or?
Well, at her preschool, the children do have the flu.
Okay. Okay, and does Laura have any siblings?
Yeah, she has an 8-year-old brother.
Okay, and he's sick at all?
He's
right?
he's fine.
Okay.
Yeah.
And Laura's immunization, has that been up to date?
Yes, everything is up to date.
Everything's up to date.
Mhm.
Okay. And has she had any kind of problem with infectious diseases in the past?
No.
Is she a child that's usually not ill or not sick at all?
Usually not.
Okay. And you said that she's vomiting. Has she had any diarrhea?
Yes, she has.
Okay. And how often would you say she's having diarrhea?
Well, today she had a little bit of diarrhea, just a little. She hasn't moved her bowels in the past 3 days.
Okay. So just a little bit today and nothing since she's started to get sick?
Right.
Okay. And a little bit today, was it loose? Was it hard? What did
It was
look
extremely
like?
loose.
Extremely loose. Was there any discoloration? Was there any blood in it?
No, I didn't notice any blood.
Okay. Did it look black or tarry at all?
No.
Okay. Was it green, extra green in color or anything?
I didn't
like that?
notice that either.
Didn't notice that either.
No.
Okay. So just a loose stool. And I mean, what is she telling you? What does she sound like? Is she able to converse with you? How is her?
She's not able to tell me like where the pain is exactly, but she'll just point and say, this hurts. It hurts, Daddy.
Okay, and just generally to her abdomen.
Yeah. Yeah.
Okay. All right.
Her belly button. Actually.
Her belly button.
Yeah,
Okay.
she points right there.
Has she had any kind of surgery in the past?
No, she hasn't.
Okay. So nothing in the abdomen, nothing anywhere else.
No.
Okay.
No.
All right. And does she have any medical problems that you know of?
Not since she was an infant.
Okay. Not since she was an infant.
Right.
What did she have as an infant?
She had like acid reflux disease.
Okay.
When she was like 4 months.
Okay. And what did they do for that?
They gave her some Zantac, and they discontinued the Zantac when she was like 9 months old.
Okay.
Yeah.
And they didn't do anything else for her? It got better on its
No,
own?
she got better. She got
Okay.
much better.
Okay. All right. You said she's vomiting. What has she been vomiting up?
Just mucus because she hasn't been eating.
Okay.
Yeah.
So no blood in the vomit.
I didn't see any blood.
Okay. And no discoloration, just the mucus and nothing else, because obviously she doesn't have any food then.
Right.
Is that correct?
Right.
Okay. All right. Okay. Is there anything else you would like to tell me?
Yeah, Doc.
Concerned about?
I guess what I'd like to know is that how would I tell by looking at my daughter if she's dehydrated?
Okay. All right. Well, a couple of things. First of all, you can, with children, you can tell a lot from just the way their skin is elastic or not. So if you pinch the skin and it's able to come back down, then that's a good sign. children have younger skin, and so it is going to come back down. But if you're pinching the skin and it stays like this, tented, then that's a really bad sign. That means they can be very dehydrated. Their eyes can even be sunken down a little bit. When you open up their mouth, the very obvious thing is you see that their whole mouth is really dry, their tongue's dry. We could say their mucous membranes are dry. Their urine output, if they're not really urinating all that much, that can be decreased as well. Have you noticed her urination changing up?
Yeah, I noticed it, and it was like yellow, dark yellow, and it smelled.
Smelled.
Yeah.
Okay. And have you ever noticed that she has had urine that's smelled like that in the past?
No.
Okay. All right. And you haven't noticed any blood in the urine?
No, I haven't.
Okay. So it's just really dark. And how often would you say she's urinating now?
Today she went once. Usually she goes like twice a day.
Twice a day?
Yeah.
Okay. She's definitely urinating like less.
Yeah.
Is she able to get to the bathroom on her own?
I sort of help her to
Okay.
sometimes
Okay.
when she has to use it.
Okay. Well, aside, like I said, the way the skin looks, the way the mouth looks, and they're urinating, those are usually pretty good signs. The fact that she's not been taking in fluids, you're telling me she's not really keeping anything down.
No.
We can pretty much assume that she's probably dehydrated. And we also have her vital signs here, and we see that her heart rate is a little up. She also has a temperature. That's an oral temperature. You probably also want to get a rectal temperature, but I mean that's still pretty high. I definitely would be concerned that she is a little deficient in fluid. And has she, I didn't ask this question before, but you said that she started to get sick about 3 days ago. Did she have like a cough? Did she have any signs of it? Did she seem like she had a flu? Because you said people at school have flu.
She just started complaining about her stomach.
Okay.
Her belly button. She would just point there.
Okay. And that's the only thing. She wasn't coughing up phlegm or.
No, I didn't notice that.
Okay. All right. And she didn't have any obvious rashes or anything on her skin.
She didn't have any rashes.
Okay. All right.
Okay,
I
so.
think you tapped me out. It's been a
All
while.
right, so let's move on. If she were here, you would do your physical exam, and this is what you would find on your physical exam.
Okay. Yeah.
All right, so taking that history and this physical exam findings, what are you thinking of for your differential diagnosis? And we want to hear three things in that list.
Okay. Gastroenteritis. B1. She's having periumbilical tenderness. I'd worry about maybe some kind of telescoping, maybe of the geometric, like a volvulus or something of that nature. She really hasn't gone to the bathroom all that much. And I mean, I think it wouldn't be unreasonable to throw an appendicitis possibly in that differential. Those are probably the 3 things I'd say.
Okay. All right, so let's say that you've thought of those things and you decide that she has acute viral gastroenteritis, and you appropriately make the decision that she's dehydrated. What fluids would you want to use to give her an IV bolus? What type of fluid would you use?
Normal saline.
Okay. And how much would you give her?
All right, IV bolus of normal. I believe
5 minutes remain.
for the bolus, if I remember correctly, it's like 20 mils per kg, if I remember correctly. So it'd just be 20 times 20, so I guess 400 mils
Good. Okay.
bolus. And then I do the 421 for maintenance.
Okay, great. So let's have you present that diagnosis of acute gastroenteritis and dehydration and your plan for IV fluid management back to the patient.
Okay.
the parent?
At this point, your daughter is really dehydrated, and from my physical exam, I can see that she really is going to need some fluids. What's causing this, however, is viral gastroenteritis. It's very common in children. Everything you've described to me fits with that. It's a common infection that kids get, and they'll be nauseated. They'll have a lot of vomiting. They won't be able to keep any fluids in. The GI tract is infected, and with that, they're just basically irritated. You could think of it that way.
Okay.
Their bowels will kind of lock up. They won't really be able to use them. Things kind of stay up here instead of flowing through normally. And that's why you probably haven't seen that she's had a lot of bowel movement. She's been kind of constipated.
Okay.
And that she's just been bringing things up and not able to keep anything down.
Okay.
So the most important thing we can do for her to help her is to replace her fluids. She hasn't been drinking for like 3 days. You're telling me she hasn't really gotten in her normal oral intake. So we definitely want to give her that. And how we usually give that is in the hospital here with IV fluids.
Mhm.
So we put an IV in and give the fluids directly into the vein. That's the fastest way and the most appropriate way to treat this. In terms of what we'll give her, we do a calculation based on her weight to give her the right amount of fluid.
Okay.
And then we'll probably keep her in the hospital for at least a day or two. Will there be anyone here with her at all? Because I know a hospital can be a scary place.
I'll be here.
Okay, all right. And we just want to watch her, make sure that she gets back to normal. One thing I did mention also that you can check too, even at home, is capillary refill. That can be increased if someone's really fluid dehydrated. Usually it should take 2 seconds for the color to come back if you touch your nail like that.
Mm-hmm.
So we'll do things like that and assess whether she looks like she's gotten back to baseline with her fluid levels. Is that going to be okay? Do you have any
Sure.
questions?
How did you say that I can really tell if my daughter's dehydrated again? By looking at her?
By looking at her again, you can look in the mouth,
Uh-huh.
and if that looks dry, if
Mhm.
the tongue looks dry, eyes can be sunken as well in children. So there's not as much of a fullness. You kind of see a depression
Okay.
around the eye.
All right.
It's kind of a subtle sign. And a very easy thing to do is if you just touch the nail here,
Mhm.
you notice as I'm touching it, the color comes back.
Yeah.
So 1, 2, 3. So if it's in less than 2 or less
Mhm.
seconds, then it's normal.
Okay.
So,
All right.
and when I did the exam on her, it took 4 seconds. So that just means that she's a little low on fluid.
Okay.
But this shouldn't be a problem. We just need to make sure that we get the fluids.
Thank you.
Yeah.
Thank you.
I know this can be really concerning.
It is. It is. It's very concerning.